Yeah, well, you're talking to someone who has a child with pre-existing condition, and so this is personal to me and to making sure that we have affordable insurance. Here's the reality: there's not affordable insurance now, unless you're subsidized in the Obamacare policies. You don't have affordable insurance. I can tell you personally, I got a silver plan in Virginia last year, and the insurance premiums were $30,000 a year. That's not affordable insurance. So the idea that there is affordable insurance now for people with pre-existing condition, unless you have a subsidy or you're in Medicaid, and in Medicaid you have insurance, but you don't have access to any network of providers. You have providers who are limiting the number of Medicaid patients they're accepting because Medicaid's such a poor payer. So you can have insurance and you don't have a lot of copays. You don't have a lot of on Medicaid. You don't have a lot of deductibles, but you also don't have a lot of care. You're not getting or the care that you want from the physician or hospital you want it from. So let's just take a step back and say, what do we have now? What we have now is a system that's broken for people with pre-existing condition. What we're suggesting is let's get this money to the state. We're not saying the state's got to do a high-risk pool. We're not saying this. What we're saying is the state has to do things to lower premiums for everybody. That could include a high-risk pool. You have places like Maine, for example, that had an invisible high-risk pool. What does that mean? That means if you were someone with a pre-existing condition, you don't even know you're in the high-risk pool because basically behind the scenes the state is providing these subsidies, and it's not really reflected in the policy that you're purchasing. So there's all sorts of good ways in which people with pre-existing condition can be maintained in the insurance market without being put into a plan that's specifically targeted for them, as you described. But we're saying that right now there's not good options for people. What we're going to do is create the states the ability to create some of these good options. And here's what we know: that more and more states are actually looking to Maine. Idaho is another one. There's others who are looking to Maine and to other states and how they're doing it well, and they'll be copying those ideas. And that kind of innovation, we believe, is going to really benefit, particularly those who are the most chronically ill and the ones who have the most difficulty in getting insurance.